She was stable. On paper, her vitals were normal. But something felt off. Her eyes looked different. Her hands cold. And 27 minutes later, the code blue was called. It always starts quiet. I remember that night, just another lonely round at 3 a.m. I walked into Miss Harris's room. She was awake, alert. Monitor read. Heart rate, 82, SPO2, 95 BP, 124/68. All numbers you want to see. I smiled, tried to sound casual. Hey, Miss Harris, just doing my rounds. How are you feeling? Her voice was soft. I don't know, just weird. Like something's not right. That's when my gut started talking. Nurses call it the sense of doom. And honestly, the patient often knows before anyone else does. So listen up, especially if you're new to the floor. Let's break down 7 early warning signs your patient might be crashing, even when the monitor says everything's fine. Because 80% of patients who code show subtle signs, hours before the event. First clue: sudden confusion, somnolence, or restlessness. Miss Harris started picking at the sheets, repeating questions. She'd been sharp earlier. Now she was forgetful, agitated. That's a huge red flag. Think hypoxia, sepsis, or poor brain perfusion. Second early sign: pale, clammy, or mottled skin. I checked her hands. Cool to touch. Mildly sweaty skin, no fever. Skin is a window to circulation. When it's clammy, the body's already compensating. Shock might have started, even if nothing's blinking red yet. Third sign: subtle increase in work of breathing. Your patient's respiratory rate was only 18, but now your patient is slightly working to breathe. You can't trust the number alone. Watch for the flaring nostril. Watch for the effort, not just the count. Fourth sign to pay attention to: increasing oxygen needs. I'd bumped her up from 2 liters to 5, but her oxygen saturation was still in the low 90s. If you're escalating oxygen and not seeing improvement, don't just bump the flow, ask why. Investigate. Fifth warning: low urine output or dark urine. I checked her Foley. Only 20 milliliters in 2 hours. Dark amber. Less than 30 an hour? Kidneys are screaming for help. Don't ignore it. Sixth sign: new anxiety, or that dreaded sense of doom. Miss Harris gripped the bed rails, whispering, something bad is happening. When your patient tells you they feel something's wrong, believe them. Seventh clue is your gut feeling. Nurse intuition. My gut was screaming at me. I hesitated, then picked up the phone. I don't like this. I'm calling the rapid. And then, rapid response was called. Phones beeping. Everyone rushing in. I replayed every moment in my head. The signs were all there. We just have to see them, hear them, feel them, before the numbers fall. Here's what I want you to remember. You are more than a chart checker. You are the early warning system. Learn these signs. Trust your gut. And don't wait for the vitals to drop, because by then, it may be too late. Drop a comment. What's a time you just knew your patient was crashing, even when the monitor didn't? Let's teach each other. And if this video helped, share it with another nurse. You might save a life. I step out into the sunrise after the code, exhausted but proud, because sometimes being a nurse means seeing what others can't. Always be proud. You belong to the most trustworthy profession in the world.